Good evening, I'm Leah Hogg. Thank you for watching our current affairs briefing in English. My guest today is the Shadow Minister for the Elderly and those who live in community care. And I'd like to welcome Dr. Maria Deguara. Thank you very much for joining us
today.
Thank
you for inviting me.
We've been inundated with questions and queries about the coronavirus and the vaccination rollout. There's been a lot of programs on Net TV in Maltese, and I thank you very much for coming to share the information with our audience in English. Thank you.
Yeah.
I'd like to start by speaking about your vision for the elderly and how they can remain living in the community.
Yes, the Nationalist Party has always had a very specific vision vis-à-vis the elderly. The aim has always been to keep the people as healthy as possible so that when they reach the pension age, they are still healthy so that they will be able to enjoy the pension age in the most comfortable way. And also, the other vision was that it was very important that we keep our elderly in the community as much as possible. This vision has even started about 30 years ago when our party was in government, and to have the elderly healthy at the age of the pension age meant that we had to start programming a lot of educational programs to teach the Maltese and Gozo nation how one can remain very healthy through life, and this can keep on even in the elderly age, which meant there were a lot of educational programs, how one should keep off what we call the junk food, off a lot of sugars, to control obesity, keep off smoking, keep off drugs. And these all meant that by keeping and teaching the population how they should live a healthy life, meant they are going to be much more healthy at their elderly age. Then we came, because obviously you keep off these chronic diseases, and once you don't get these chronic diseases at the age of 60, 70, you can still be quite healthy to continue with your daily life without any help from whatsoever.
So then, what you're saying is prevention is better than cure.
Yes, that was the prevention part of it. Then once people were elderly, you had to help them to remain in the community, because that is the most important thing, that you leave the elderly living where they have been born and bred, because this is the ideal way that the elderly should be kept. To help these people remain in the community, even as far as 25 to 30 years ago, a lot of services were introduced in the community. They had the telecare, they had the handyman service, the Meals on Wheels. These are also the services that you could get from the government, home cares. We had also starting services like physiotherapy going in the homes of the elderly. We're speaking on the private sector. So this all helped a lot of elderly couples to remain living in their abode. Finally, you have to admit that time comes when the elderly can no longer live on in their own houses. So we had to think also about the long-term care in the residences. And again, there we had the vision of making or building the first residences in the community to try and keep the elderly that needed the long-term care, but still within the community where they have been used to. So this was the ideal way and the vision that the Nationalist Party has always had for the elderly. Today, a few months in the beginning of the year, We have two documents issued by the World Health Organization and by the European Commission. And when you go through these two documents, you find that the basic principles in all that they are suggesting by the age of, by the 2030 are actually the basis of what we have done or what we have started 30 years ago.
Sure.
These services are still there, they are running, and I have to admit the present government did also continue to make them even more practical and increase also more services. And I think if we keep on, because this is not a matter of who is in government, but there must be a continuation
Yes.
of these services and increasing these, the levels and standards both in the community and also in the residences.
Mm-hmm.
So I think our vision has been proved to be the most ideal. Unfortunately, we are realizing today that the present government seems not to be so confident to keep the elderly in the community, because we are getting a lot of new residences being built,
Residential homes, yes.
residential homes all over the island, which means you're giving the idea that after a certain age, your place is to go into a residency. And I think this should not be the ideal. Yes, you need them. I'm not saying you don't need them, but you have to balance, increase more services to keep more people in the community, and also increase the standard inside these residences, because after all, we have to think that these elderly, no matter whether they are in the community or in a residency, they must have the best standards of living possible, because after all, they have given a very big share of their life to the community and to the nation.
Absolutely. You mentioned some services earlier on. I wasn't aware of the handyman.
Yes.
So people who are not aware of the services that are on offer, where can they find more information?
They should communicate with the Ministry for the Elderly, because now we have a Ministry for the Elderly, and rightly so, because this is a big, we're referring to about more than 120,000 which are regarded as being elderly in our country. So they do communicate, they say what they need, and then they'll help them around, because they usually have the service of the handyman. If you need, for example, to change the curtains and you're an 80-year-old lady, you can ask, and the gentleman comes over and does the work for you. Obviously, they have to book it, because this is a service for all over the island, and it runs pretty well.
Well, that's really good news, I think. That's
Yes,
really
it
good
is.
news. Can we focus a bit on the rollout of the vaccine? We've had a lot of calls. People want clarity. I believe they've called the helpline number, and some people still have no joy. So I wonder if you could give us an update on that.
Yes, about the rollout, we're still a bit skeptic, because it's not so transparent. I mean, you hear people, there is a program how this vaccine is being distributed, both in Malta and in Gozo. But things don't seem to be moving according to the program. Now, we have to understand there are, at the moment, 3 vaccines available, which is the Pfizer, which has to be given from the age of 70 upwards. We have the AstraZeneca, which can be given from the 70 downwards. And now the Johnson has been also approved in Europe. I don't know if we have received the first batches in Malta, but we should be having some batches there. So there was a lot of, you know, on the news about this AstraZeneca thing. Yes, there were about 17 million shots of AstraZeneca has been distributed all over the world. And about between 35 or so, unfortunately, were said to have fatal consequences from the vaccine. But the test carried out by the EMA, which is the authority, European authority for medicine, for checking the medicines, has issued that the percentage of deaths which were supposed to come after the vaccination of AstraZeneca is too little when compared with the percentage, with the normal percentage that you expect. It's a much lower percentage than the actual percentage of deaths that we expect from natural cause of thrombotic death. So these could have been a coincidental deaths, not because of the vaccine.
Okay.
So they have issued that this is completely safe to keep on going all over the world and to be given to the patients. So I want to rest the mind of anybody watching us that AstraZeneca at the moment is still safe to be taken and there's no questions asked. The Pfizer, as I said, has to be given to the elderly. So you may still get people who are of an older age, above the 80, 90 perhaps, that may not have been given the vaccine. So if they have not been given the vaccine, they should check why, because they may not have taken the Pfizer, perhaps there may not have been enough for everybody to take it. But once it is available, definitely they will be getting it. Now, we usually have to contact on the number 145, which unfortunately we're having a lot of problems to get through.
Yes.
We did pass on the message, and it was supposed to be not updated, but more people are supposed to be put on that line to answer the questions for these queries about vaccines. I think we're not transparent because we're seeing certain people getting the vaccine before others when we're saying only, for example, just to give an example, we're saying between the 60 and 65 should be called. And then you find people which are 40 being called and then without any complications. So yes, I think apart from knowing how the program is going to run, it should be more transparent how things are being carried out. Because after all, people start doubting what's happening. And the more doubts you get, the worse. For us, it's the most important that the rollout is done as quickly as possible and that as transparent as possible so that everybody's happy, everybody knows what he should be having. And we should go on media to explain what I've just explained, for example, about AstraZeneca, because I get a lot of telephones coming in every day, every minute, asking whether they should get it or not. Because if you go on media and say all these, I think the people will get their mind rested that they are quite safe to go and have this vaccine.
May I ask you about the side effects, the basic side effects that people feel or experience after having any sort of vaccine? Would the side effects for somebody who is 60 years and over be more severe?
Not really, no. When you take a vaccine, you either have no effects whatsoever. You may have slight effects. Let's take the COVID as an example. You usually may get a spike of a temperature, but goes down within 3 days. You can have muscle pains, bone pains, migraine. These are all very common side effects, but they all go off usually within a week. In fact, we do tell the patients taking them that if, for example, the temperature persists for more than 4 or 5 days, they should have themselves tested for COVID. Because don't forget, COVID presents in the same way as these side effects. And you may have had the COVID and you did not know about it and you went for the injection. So we always maintain that if the temperature or the side effects are becoming more obvious and more severe after 4 to 5 days, you should have yourself tested for COVID.
Okay, that's great. What about lockdown? And we're focusing on the elderly today. The elderly are experiencing loneliness, isolation, and that leads to depression. What sort of support is available?
It's very true. They've been logged in, for example, to put it in a nice way, since March last year. The problem, they did not have any way of communication. So they found themselves locked in a room or perhaps on the same floor with some of their friends. There were times where they did not even leave their rooms. So it's quite obvious that they fell into a certain solitude, depression. We did speak many times to help these people to get some contact by the digital, by the modern digital communication. And after a year of saying and repeating the same thing, that these people have to be helped, at least the minister about 3 weeks ago said that it was going to install the first free Wi-Fi in 1 or 2 of the residences. And I think this should be very, very quickly done in all residences, because a lot of the elderly don't know how to make use of these modern digital apparatus, the apps, whatever they may use. And they should be given help by people inside the residence to make them or help them communicate with people outside. Don't forget, about 3 weeks ago, they were informed that because the majority of the people in the residences had been vaccinated, and because the numbers were low, we're speaking about 3 weeks ago, they were going to have to remove all directives that they have put on the residents. They were no longer, they told them, you will no longer have to speak through perspex, you no longer have to stay in your room, you go down to eat together, and all the rest. And then within 2 days' time, the number of positives rose up to the 500, and everything, all their hopes perished in thin air, because they were relogged again completely in the residences, and again they are facing the same problem they had a year ago. Don't forget, we also had fatalities. Up till today, we have 363 fatalities, and here I do show my sympathy with them, and not only with the disease, but also with the families, because the families are here and they know what happened. And it's not the first time they ask us, was there the need for them to die? Have they enforced really the directives of the health department? Have they really done good contact tracing? Have they really done what they should? And people who were not obeying the directives, were they in any way controlled? I think this is a very sad situation, because the problem of spread of this virus, it's not we don't point to one because there is a variant. Come on, it's not only the variant which shows it. It's the main problem is the fact that there was no enforcement or very little enforcement. And this we can prove because after public holidays and public activities, the numbers always rise within a week. Mm-hmm. And this shows that definitely there is no enforcement there. Mm-hmm. The contact tracing also was a lot of problems, and we did remark, and in fact, even on the newspaper of last Sunday, it was noted that we were 9 days late, and at least the following day, the Minister of Health did admit that this is a situation, and they increased about 13 nurses and 6 doctors to help in the contact tracing. But it is a must, the contact tracing comes up to date, because if you have 300 new positives, and these have contacted 4 people wherever they were, and you go and check, tell them 9 days following, if you start multiplying the 300 by the 4 and by the 9, yes, you see how many people have come in contact.
Yes.
So I think, yes, everybody should obey what the authorities of health are telling us. The ministries should take care that contact tracing and enforcement is carried out if we really want to get, and we wear with masks, the usual things, if we really want to get hold of this COVID virus.
Get back to normal or near normal. What are your comments about the recent spike itself? How can it be controlled in the future?
The recent spike, as I said, there were reasons for it. If things get out of control, and I have to also mention the big pressures we have on the health sector. Don't forget, we have about 32 in the ITU now, where there are about over 230 inside the hospital. They are occupying a lot of space which was never meant to be for COVID. You have surgical wards, medical wards being used. You have ITUs almost full. You have also CCUs also being now transferred to COVID ITUs. So a lot of usual work carried out in the hospital, the routine operations, routine tests, outpatients have all now stopped. And this also will show back on us within few months, because we have people who are diabetic, they have not been seen for a whole year now. And they just give a phone call and say, are you okay? Okay, continue the same treatment. And in
I
fact,
believe some people have told me they've been given appointments, elderly people, for a year from now.
exactly, and that's what I'm saying. Now, if you have, for example, a diabetic who does not know how to control himself well, within a year, things will go berserk. In fact,
And people with heart problems too, I believe.
and anybody,
Yes.
diabetics, heart problems, high blood pressures, unless they are well monitored, and they usually used to be seen by every 3 months or every 6 months, things will go berserk. In fact, we have to admit that this year, for example, the percentage of amputations in diabetics have risen very high. When up till a year ago or so, the percentage of amputees were almost unheard of. This means uncontrolled diabetes. We're having people dying at home with chest pains because they are afraid to go into the hospital. In fact, one of the senior cardiologists told me that a lot of people are losing their lives because they are terrified of going to the hospital,
Yes,
because they don't want to contact
They are,
COVID.
absolutely.
In fact, I do tell our viewers tonight, if you feel anything, go to the hospital. Don't be afraid of COVID, because it's not only COVID that kills people, but there are a lot of diseases that can kill.
So basically, if they don't feel well, they go to
They should
emergency.
consult to the
They go to
emergency, yes.
emergency. Can we speak about grandchildren and the contact with grandparents and the contagion? What are your views about that, and how should people go about it? A lot of families are suffering, I believe.
Yes, as you know, I mean, because of the new directives by the health authorities, schools, a lot of schools have closed up. All they are on learning through distant learning, and children are known to contact or to transfer the COVID much more easy. They may not show it, but they can be sort of a means of transport. So the grandparents, especially if they are vulnerable, have to be on the lookout not to come in contact, especially when they were still attending the schools. Now, once they are in the homes and time starts going as we used to do, as a year ago, probably everybody settles in his own bubble, in his own home. Now, the new directive, because they have found that there is a lot of spread of COVID between family unions, they have maintained that only 2 bubbles of the same family should meet at one time. And this is a very good thing to do, because even though they are members of the same family, some of them may be running out and about, and you go and meet them on a Sunday, you have 8, 9, 10, 20 of them, and one of them has the COVID, especially if it's the variant, and you have all of them gets it. So the more away we keep, the better. And obviously, we should meet when really necessary.
And what about grandparents who have had their vaccines? Can they meet the grandchildren?
The vaccine is not a guarantee that you will not get the disease. You have people who even had one COVID and got the COVID again. So if the vaccine, until we get what we call the herd immunity, which means until you get 70% of the whole population of Malta vaccinated, and it's not easy to come to that state, you can't feel safe to start releasing or getting a bit more lenient with the contact because
meeting.
You can still have people who have the disease, don't show it,
Yes.
and some of them may not have had the vaccine. There is still.
Thank you. We've run out of time. Thank you. Very informative. Thank you for being with us tonight. The program with Dr. Deguara will be aired at some point in Maltese very soon. Keep your questions coming in. And I was with Dr. Maria Deguara, who is Shadow Minister for the Elderly and Community Care. Thank you for watching. Good night.